Civilians always pay the highest price in conflict. Medical aid during conflict, we know, is critical to saving lives and, more importantly, is protected under international law. Yet, in recent conflicts, much of this life-saving aid has been denied. I wish to raise this debate to highlight that civilians are impacted, medical aid workers are impacted by armed conflict. Everyone caught up in conflict has an inalienable right to aid, and it is not the gift of any country or anybody else. Indeed, and I note that under international human rights law, the rights of the wounded and sick must be respected in all circumstances. Attempts upon their lives and violence against their person are strictly prohibited. I would also like to acknowledge the important work of organisations such as Islamic Relief, who work in my constituency of Glasgow South West and, of course, throughout the UK and indeed the world. Children in Gaza are dying and suffering needlessly. Nearly 70% of people killed in Gaza are women and children, according to UN Human Rights Watch. The report has found unprecedented levels of international legal violations, including the right to medical aid. This includes children now having complex medical needs without access to the requisite specialists in any other country nearby. Can I ask the Minister what discussions that could be had with regional actors and the UN about potentially bringing such children with complex medical needs to the United Kingdom for treatment, as some of our international partners have already started doing? Despite this, medical aid is severely restricted in Gaza. UNRWA and other aid agencies have been unable to deliver essential medical equipment, such as medical swabs to stem bleeding or life-saving medications, such as penicillin. Essential vaccine campaign rollouts have been delayed, and this has all been compounded by this weekend's events. According to the Famine Review Committee, famine is a strong likelihood in Gaza. My conversations with colleagues on the ground in the region have confirmed how scarce food is, with very limited meat, cheese, snacks, fruit and vegetables. I understand that people are now surviving off rationed rice. As an international actor, it is imperative that we ensure that international law is upheld and medical aid reaches people caught up in conflict everywhere. International law dictates that people who are providing medical tasks must always be respected and, more importantly, protected. Medical professionals in the region are risking their lives to treat the injured and ill. My honourable friend made mention of my colleague, Professor Nizam Mahmood, who recently returned from a month of performing surgical operations in Gaza. He told me when he was there and on his return of the lives that he tried to save in increasingly difficult circumstances. He described it to me as hell on earth. I conclude by reiterating the salient point that anyone caught up in conflict has the right to aid. It is not a gift or an act of benevolence by anyone else. We must ensure now that our record on this issue is one that future generations of this House can look back at, not with regret or contrition, but with pride. Yeah.